met Annie probably at the beginning of the academic year, and we talked a lot. I'm a psychologist by training. Annie is an anthropologist, and we had a wonderful conversation about her research. And I said, "Oh, would you be willing to present at the QRDG?" So she gracefully accepted, and I'm very grateful that she did. And with that, I will pass it over to you, Annie, to begin. And you can talk to everybody about whether questions you want in the chat room or if you want them to just speak out.
Oh, okay. Give me 1 second while I make sure that I have everything in place. Thank you much for the invitation, Loretta. It's really a pleasure to be here. So just by way of introduction, I'm a cultural anthropologist. I did my PhD here at Yale, and I now work in the Department of Psychiatry, which is such a thrill because I don't get to be intimidated by other anthropologists, or there's not many of us in the Department of Psychiatry, but I also, more importantly, feel like I can bring the learnings of cultural anthropology to psychiatry, really thinking about the social and structural determinants of mental health in a way that being trained as an anthropologist enables me to do. So it's really an amazing opportunity to be an anthropologist in a department where that's not usually a thing. And my focus as a researcher, so I'm an assistant professor, and my focus as a researcher is on the connections between poverty and finances and mental health. And I look both at the financial problems that people with serious mental illness experience, whether that's access to banking, social security benefits. I'm very obsessed by debt, as you will soon discover. But I also study more generally the effects of poverty on and finances, particularly on people who are marginalized in other ways. So people who are just low income, people who've been incarcerated, people experiencing homelessness. And I work very locally because I try as hard as I can in my work to make it immediately impactful. So most of my research is in and around New Haven, but I have done some state level work. So I'm going to share my screen and go through some slides. And I really look forward to your comments and feedback. Either if you want to shout out, if something's not clear, please feel free just to shout out, or we can wait till the end.
And while she's getting her slides, one more plea to please put your email address in the chat room so we can send you announcements of future QRDG meetings.
So just to make sure that I'm doing this right, can you see the slides?
We can.
And can you see them in whatever it's called? Slide.
So yes, except that it's not full screen is the one thing I'd say.
Okay, what about that?
That's perfect.
Great. Okay, wonderful. So the reason, so my title is a bit odd: Research with Results or Alphabet Soup, Promises and Pitfalls of a Community-Based Participatory Action Transformative Mixed Methods Approach. The reason I gave that title is what I'm going to talk about today, is that I think about a lot the translation from the ideals of community-based research into practice. And as someone who writes a lot of grants, because I don't teach, so I'm fully grant funded, I think quite a lot about the difference between what I put in a grant, the language I use, the citations that I make, and then what we actually do in practice if we're lucky enough to get funded. So that's really what sparked what I'm going to talk about today, these kind of concerns that there's frankly often a mismatch. And sometimes that's because we've been over idealistic in the proposal. Sometimes it's because it's just really hard to do in practice what you said you're going to do in theory. And the reason why the title is so long is because I feel like every time I try and read up the latest on these methods, I see something new that I'm supposed to be including, and I wonder how new it really is. So that's why the title is like that. So why do we bother using these methods? In my opinion, it's to make sure that we're answering questions that actually need to be answered. I think as researchers, and personally someone who doesn't have lived experience in the things that I study for the most part, which is poverty and mental illness, it's very easy for us to think, someone like me, to think that something's interesting and relevant when it actually isn't. So one of the reasons that it's important to have community, as in, the definition of community here being people who are more directly impacted by whatever it is we're studying, to make sure that we're addressing something that's actually relevant in our research. Also to actively involve the people most impacted by the problem that we're studying. That's for kind of moral and ethical reasons, but also frankly for practical reasons that I have found, and I think it's true, that the more people who really know from personal experience what's happening, the higher the quality of the research and the more actionable the any recommendations. And the third reason is related, right? That I think the goal of this kind of research is to actually make something happen. Now, an academic paper is something happening, but I'm talking about like actual things happening on the ground, whether it's programmatic changes, policy changes, whatever that might be. And then I think fundamentally it's about changing power structures because the kind of work that I certainly do, and I think a lot of us who do community-based participatory research, is specifically addressing problems that have, in part at least, to do with a lack of power by the people who are most impacted. So I think the research is supposed to contribute to changing those power structures. And then just personally, the reason I do this research is because that's what I was trained to do. I know how to do qualitative research. For me, it means doing work locally. I don't think that's always has to be true, but for me, that's important. And also, I think because it's a community-based research is about people and the way people think, and you're engaging with people, you kind of have to take it personally. Community-based participatory research is idealistic, and I think you kind of as a researcher have to be a bit idealistic as well. So there are tons of methods, right? That I think enable us to do these four things. And as I said, one of the challenges I have is what I put in the grant proposal versus what I do in practice. And the most recent proposal that I wrote, which was a proposal to the NIH to do research into the mental health effects of alternative forms of housing for people who are homeless, specifically tent encampments and hotels, which were norms during the COVID pandemic, the worst of the COVID pandemic. So I was looking into, right, what's the latest in qualitative research that I can bring into this proposal? And this quote, I think really, which is called transformative research, actually kind of sums up one of the things that I'm trying to do in my research. So I think all this is great, right? The stuff that I read is really helpful. I think the grant proposal we wrote was fantastic. But what about when it gets funded? What about when you actually try and put this into practice? So I'm going to talk about one specific project where I tried to put this into practice and face lots of barriers, because I think it's really important that we focus on what we really do versus what we say we're going to do. So the first thing is, and I could just actually, the whole presentation could be, it's very difficult. It's very difficult, I think, to do community-based participatory research well. I'm not saying that quantitative research and other types of research aren't difficult. I just don't know about them, but I find the research that I'm supposed to be an expert in incredibly difficult. It involves complicated relationships. It's about working with people across a spectrum of power, of positionality, of race, ethnicity, economic, power. And those relationships are complicated. And I think if you do community-based participatory research, well, I'm just going to say CBPR, well, you will endlessly be confronting complicated relationships. If that's not happening, you're probably not doing it well. But it makes it difficult. For me personally, as a bit of an introvert, it makes it difficult. We always use community advisory boards. I kind of, the first time I got into this, I was like, well, that's going to solve everything. And it really doesn't. It's very easy to have a community advisory board that is tokenistic and doesn't really affect the work and, brings in people who are used to being on community advisory boards. So it's an essential thing, but it's really hard to do that well. And I think that the fourth one is particularly important. The balance of power between me, particularly me, a white woman, a researcher with no personal lived experience of the things I study for the most part, and the people who are both involved in but also being studied, remains really messy and problematic. And just one example I'll give of that is because we recently got an NIH proposal, we were funded, and it's an R01, and it's a CBPR project. So as a result of getting that grant, so clearly of doing a good job of saying how we're going to do CBPR, I got promoted and got a salary increase, which actually increases the power differential between myself and the people that I'm working with on the study. So that's just one of the ways in which I just think we have to acknowledge that in some ways, as we get better at this as researchers, we actually become more distant from some of the problems, depending on what we're studying. And then the final one is just that it's, you know, it's humbling. I think if you do it well, it's humbling and sometimes frankly humiliating, because again, from my particular position, the work I'm doing is challenging who I am and what my role is. And sometimes that's embarrassing. I've got no problem with being an expert, and I don't, there's a great philosopher called Taiwo who explains why it's important to have people with lived experience, but also have experts who don't have to have lived experience. So I think that's true. But at the same time, you know, I am, in my work, I'm challenging the very position that I hold in society, and that can be confusing sometimes. So then the more kind of practical things, it's the findings of this kind of research are often kind of vague, right? You found out some things, you're not sure if they're true. I think they're true. They're complicated. It's often not clear cut. One thing that is very relevant to funding is that there's no clear start and end dates. You can't just start a project in September because that's when the funding starts, right? But you often don't know until if you've got the funding until September when you're supposed to start. And then as you'll see from my example, the end date is also very, basically it never ends, but the funding does end. And then the funding sources, as I said, often don't accommodate this, right? It's mixed methods research, which is what I do, is incredibly time consuming. Qualitative analysis, if you do it well, takes a long time. It's very often, it's unpredictable, right? And I'll talk about that, that you don't know what you're going to find. So to be able to outline a 10-page proposal, which says what you're going to do, when you say at the beginning of the proposal, we are going to spend the first year doing CBPR so that we can make sure we're doing the project right. But then you have to spend the next 9 pages describing what you're going to do, always with the understanding that that might change because you haven't done the CBPR yet. So that, I mean, we got funded for this particular project, but it's hard because we're saying this is what we might do. It's often political if you're thinking about hoping that your work will contribute to policy change. I know when we were writing the proposal that got funded, frequently my co-PI, who's done this much more than me, was like, Annie, you can't write that. Like, this is NIH. You can't take a political stance. And then the last one is that, you know, I think the idea of research is you do the research, you get the results, and then you know what you found, and then you can like disseminate or whatever it might be. But in practice, sometimes a situation requires that you need to support an advocacy process or whatever it might be before you've actually got the final results. So yeah, that's something else I'll talk about in the example that I'll share. So this is the example I'm going to share is a project I can't say we did because we're still doing it, but we haven't got funding, so we kind of aren't doing it, called the New Haven Debt Map. And there are just some quotes there about kind of the description of the project. We called it locally rooted, policy and action oriented, community based. And, you know, I put in orange other words that we could have used to describe the project, focusing on the debt experiences of low to moderate income people living in New Haven. The goal of the project, and one of the reasons we stayed local, was because we want to inform advocacy for policy reform, and policies around debt happen to be municipal and state much more than they are federal. So we kind of needed to understand, we considered the policy making environment and who gets to make decisions about that as we decided on the location of the research. And so, yeah, that's what I've already said. Just a bit of background about why we cared about this. And, you know, myself and my co-PI, Tommaso Bardelli, had both worked on debt prior, or had worked on projects where lots of questions about debt came up. So it was done for a reason. And this is just, you know, probably not news to anyone, but the amount of debt that Americans are in, and especially particular Americans, i.e. low-income ones and people of color, has grown over the last 30 years, and they are debts that are consequential in the sense that they directly impact people's lives and negatively. So this is just some context about why we decided to do this project. So the process was, oh, and just maybe to also mention, both Tommaso and I hadn't done specific research studies that led to this. I had done a study, we'd done a study together actually, doing qualitative research with people who'd been incarcerated and had mental illness and just heard a lot about debt. I had done research on the financial problems of people with serious mental illness and had learned a lot about debt. And one of the things we found is that while there's a lot of research on debt, there was very little research on the types of debt that very marginalized people have. So there's great data on credit card debt and auto loan debt, but much less data on overdrafts and utility arrears, for example. So we really wanted to be able to dig into those kinds of debt. So it was a qual project. And I should say I learned about mixed methods long after I finished my PhD in cultural anthropology, because in anthropology, we just do ethnography. We just like hang out with people. So this, I'm kind of new to this, even though I'm, an experienced qualitative researcher. And just, so before we, yeah, go ahead, Loretta.
You're very responsive. I think I would be curious for the group also, what was your rationale for proposing qual, quant, qual? What were you doing? I think that since it's mixed methods, and this isn't something that we're trying to do more on mixed methods, I'd love you to go through a bit of the rationale behind what your design was.
I'm so glad you asked that. Thank you, Loretta. And I'll do that now before I go into the detail. I think qual, quant, qual is where it's at, right? And the reason I say that, I think in a way I think it's sort of obvious. The qual is to know that when you do the quant, well, let me back up. There's one primary reason, which is true of any mixed methods research, I think, which is that when you have numbers and stories, you really have a fuller understanding of whatever it is you're looking into. And also, super importantly for this kind of research, when you have numbers and stories, you convince policymakers of the need for change, because some care about numbers and I think they all care about numbers and they all care about stories, but when the two things are meshed together really well, I think it's incredibly persuasive. So there's like a kind of a sort of political strategic value to doing that kind of work. Now, the qual, quant, qual, I think, is because as someone who doesn't have that much experience in quantitative research, when I use the results, of that, of quantitative research, which I do all the time, right? I read papers that are about quantitative studies. I'm frequently frustrated that the surveys used didn't ask certain questions. For example, types of debt. Right? They ask about certain types of debt, but not others. So for me, the qualitative is to make sure that the quantitative, which we need for the numbers piece, is actually asking the right questions in the right way of the right people.
So for the mixed methods, let me interrupt you. For the mixed methods, what you've just said is you did what would have been what could have been a mixed methods project in and of itself. It would have been an exploratory sequential where you used the qual to inform the quant. Now take it away, Annie, and finish your stuff.
So basically it's a combined explanatory exploratory. So the exploratory piece is the initial qual, right? You then do the quantitative, and then, as with all quantitative studies, I think all can benefit from this, you follow up with more qual to explain the quant. So it's exploratory and explanatory, if that makes sense. And I think it worked. Maybe that's why my concern that this takes so long is because I like, for me, it's like we always need a bit more qual. Oh, but maybe we need some more quant, whatever. Anyway, so that the initial qualitative phase was, as I said, to make sure that when we did the quantitative side, that we were actually asking the questions we needed to ask. And we knew already that we didn't know, or that there were types of debt out there that we hadn't known about, and that maybe there were others. So what we did in that initial phase, our goal was to to make sure we were asking every question in the right way about the kinds of debt that low-income people in New Haven have. So we had 4 community conversations. A couple were just very public sessions in libraries. And then a couple of others were focused, like one, for example, was with a group that meets regularly, people who have mental health problems and have been in prison. So some of them were focused, some of them are public. Through those community conversations, and the picture there is one of the flip charts that came up through one of those community conversations. And basically we just asked people like, look, we're interested in debt in New Haven. What kinds of debt should we be asking about? And we heard about so many different kinds of debt. We actually added 8 completely new categories that we hadn't thought about. So we did start off with a survey, but then the goal of this was to refine this. So for example, VIG, I think it's VIG, it's up there. It's something to do with gambling in prison that I knew nothing about, but people often come out of prison with that kind of debt. I didn't know that. The DOC lien, I had no idea that if you've been in prison in Connecticut, and when you come out, if you in any time in the next 20 years win a legal settlement or get an inheritance or win money through gambling, the Department of Corrections can take up to half of that money to pay for your time in prison. So that's a debt that I didn't even know existed. And there are many others. I didn't know that library fines impact people's lives in the way they do, right? So we really wanted a very expansive definition of debt, and that's what we got. We then did focus groups where we basically put the draft survey on tablets and then had each person in the focus group do the survey. And then we had a discussion afterwards, like, okay, what did you think of that? What didn't you understand? What was missing? What was confusing? And then we did the survey in a kind of like interview format with 10 people. So in the focus groups, people had done it themselves on a tablet. In the interview format, we basically walked through every question with someone so that we could record kind of comments they made as we went through it. And after that, we finally, finished the survey. And I will say we not only added different debt types, we also changed the wording of most of the questions about how we ask about it, so it made sense to people. We also realized you can't just ask one question about debt. You have to ask, how long have you had it? Are you behind on it? What has happened because you've been behind on it? Like, so you can't just ask someone, do you have a car loan? That's meaningless. I have a car loan and I'm fine. You have to ask, how much do you pay? Can you afford that? Are you behind on it? If you haven't paid, what's happened? So we really tried to get at the consequences of debt. The cost of that, of course, was that the survey was incredibly long. So that was the kind of ongoing balance. Like, really, we should be asking 1,000 questions, but realistically, we can only ask however many it was. So then COVID happened. And I think if COVID hadn't happened, this would have been quite different. But as it was, we had to make do. So we ended up, rather than doing an administered survey with up to 100 people in person, we ended up doing an online self-administered survey with just around 400 people. So there were definitely pros and cons. I think we really paid in terms of data quality and knowing who we were speaking with, but we got 400 people. So that was, there was an advantage to that. I can go through all of the challenges of community-based recruiting at a time when you can't gather. And it was really difficult. And we did a lot by email. We ended up paying something ridiculously small, like $20 for a Facebook ad, which was great because we got about 100 people, but bad because we very nearly paid the $10 stipend to about 200 people who weren't real people. But luckily we had set it up so that didn't happen. Yes, Loretta.
Again, just for us to understand, on that quant survey, you said it was incredibly long. How many items? I understand that there's skip clause, so not everybody may have been answering every question, but give us a rough of how long, how many items, how long did you estimate it would take? Something like that.
I think, off the top of my head, I can't remember. It's probably around 50. But most people, and this was something we were testing in the focus groups, right? It took about 20 minutes to half an hour. I think it probably took longer for some people, but that's what the focus group experience.
I have to laugh because I think that incredibly long, your words, in so many surveys that I've seen, where particularly if it's multidisciplinary and involves some kind of health problem, we were talking in terms of hundreds of items, where
Right.
it would take up so incredibly long, 50 items, 20 minutes. That's not bad. That's not
No,
bad.
totally, I get it. But that was also, believe me, if we'd been doing them in person with people, it would have been longer. We really had to crunch once we knew it had to be self-administered. And I'm still wonder today if we should have just done it over the phone, because I think we did lose quite a lot in terms of quality by having people self-administer. But you know, that was what we did. So this is just showing that we did, in our efforts to kind of remain community-based in the world where we were all stuck in our houses, we created a Facebook page and tried to get that out there. And there was some like kind of interesting discussion on the Facebook page. And I really wish we'd been able to develop that further, but as I'll explain, we weren't able to. And then the final phase was the qual, right? Exploring the results of the quant. And a barrier that we faced here, which I think is probably fairly common in mixed methods research, is we didn't really have anyone who could analyze the 400 surveys. My colleague, my co-PI, has some experience, but suddenly this was 400, and we had to think about data cleaning in a way that we wouldn't have had to if we were doing it with people. So there was a fairly long period of time of us looking for someone who could actually help us do this and make sure we were doing it right. And we didn't have any funding for that. So trying to find someone who could do it for free. So we found an amazing econ PhD student in the end, but it took time. And you know, she's doing it for free. So there were limits on how much we could demand from her. So that extended the time of all this. Just, I should have said at the beginning, we got a $15,000 grant from Johns Hopkins 21st Century Cities Initiative to do this. So it was not enough money. But, you know, we found that out later. We didn't realize at the beginning. We thought it sounded great. So we identified a subsample through this method. So we had found from the quantitative results that, you check I'm getting this right, that, so one of the key, so we asked all of this stuff about debt. And I should have said at the beginning, we were interested in associations between debt and health. So we also had had a physical health measure and a mental health measure. And one of the findings that we eventually got to when we were able to do the analysis was that people with a higher number of unsecured and non-loan debts, and I'll define those in a minute, were more likely to report symptoms of depression and for poor physical health. And the association was stronger for people who were low income. So that was kind of the quant finding that we wanted to explore further in our next phase. Just so you know, the difference, debt can be divided into three categories. Secured debt is when you have something being used as collateral for that debt. So like a house or a car, which means that if you can't pay the debt, the lender takes that thing and it pays off the debt and it's gone. Unsecured debt is when somebody lends you money on the expectation you'll repay it, but there's no collateral, like a credit card. So if you can't repay it, they will come and take other stuff from you, like money from your bank account or whatever it might be. So that's unsecured debt. Non-loan debts are when you didn't borrow from someone, but you fall behind on a payment that you're supposed to be making, like a utility bill or a fine. So there's three kinds of debt. And we found, which was not altogether unexpected, that, I'll back up. People who are lower income are much more likely to have unsecured and non-loan debts. There's been some research done on unsecured debt, almost none on non-loan debts, basically falling behind on bills, which is what's most common among low-income people. So those secured debt, people have secured debt usually fine. We found that people with unsecured debt and non-loan debts were more likely to report ill health. So we sampled for the qualitative phase people who fit into that category. Lower income people who reported depressive symptoms, more likely to report depressive symptoms and poor physical health, and who had a high numbers of unsecured and non-loan debts. We also then, and I can't answer questions about this because my colleague Tommaso was the expert on this, selected some deviant cases, which is people who were low income and had those types of debt, but didn't report poor health, or who were low income and had different kinds of debt, but did report ill health, because we wanted to kind of see qualitatively what might be going on there. We did 29 in-depth interviews all over Zoom. It was a fairly exhaustive process for the people we selected, of going through their survey. So we had a kind of crib sheet for each person of what kind of debts they had reported they had in the survey, basically their survey results, so that as we did the interview, we were building on what we knew from their survey responses. So that was fairly exhaustive, creating a sort of tailored interview guide for each person. And then we analyzed, like I've just written that one-word analysis, obviously it took months, because by this time the money had run out and neither of us were being paid for this. Okay, so then this is where I felt we really fell short. So we finally had some super interesting findings. And I feel now frustrated to this day that our CBPR component of this project, we've really fallen short, because we didn't really have a phase 4, right? The money's run out. We've done the analysis. Tommaso's looking for a job. I'm like writing grants or doing other projects. And our goal of keeping it, like taking this back to the community, kind of fell apart. So partly because it just took so long, which was partly due to COVID, but not entirely. We were like, people probably forgotten about this. They don't even know that we did this like 2 years ago. There was, there's pressure to produce academic publications. I'm not so much on that track, but the co-investigator on this, Tommaso, he's like finished his PhD and looking for a job. So he needed to get an academic paper written, which unfortunately, as I'm sure takes ages. Just thinking about how do we get the word out? What kind of publication, what kind of format do we need to actually make this available and useful to people? Where do we put it? I don't know how to make a website. Just so many questions around how do we do this? We did a webinar for Johns Hopkins, who funded this, but people have to go and find the recording and watch it. We have done a fair amount of ad hoc sharing, which has been possible because we have great connections in New Haven where we do this work. So we shared the findings on Facebook. We did have a website, but it's really crap because we had to make it and we didn't have time or expertise. But there were, just through connections, we were able to share some of the data in a way that I think is useful. So we shared our information about people who are behind on car taxes, which helped, which was one of the pieces that helped lead to some reform in when the city tows cars based on non-payment of taxes. We shared some data about the racial disparities in debt when I gave testimony to a process that was happening with the Board of Alders around racism as a public health issue. There's a local student loan reform advocacy group, and we shared our data about student loan debt and with them. There's been advocacy around reform of overdraft laws, and we shared our overdraft both at the state and federal level, and the policy reform was successful in Connecticut. Basically means that banks and credit unions have to report how many people and who are paying overdraft fees. We had some data on overpayment of disability benefits, and that's debt because you then have to repay the Social Security Administration the amount that they say they overpaid you. We helped contribute to some reform on that. And then we also shared our medical debt data with Medicare for All advocates. So I'm proud and excited about what we were able to share, but frankly, we were only able to share those things because people knew me, or I reached out to someone that I saw, some advocacy effort that was going on. And the dream was that it would just be there for people to get as needed, not have to go through an email to me. So that's been kind of frustrating. So just some of the lessons that we learned, and I've said all these, but I'll just repeat. So the first thing is that doing this kind of research effectively really requires relationships, right? You can't just go to community and say, right, we're doing this research, will you be involved? Especially in a context like New Haven and Yale, where there's very good reasons for distrusting Yale. So if Yale researchers show up, as we so often do, and say, hey, we're going to do this really useful research, if you don't have a prior relationship, it's, nothing's going to happen. But building relationships, genuine relationships, takes time. And if you work like I do on poverty and mental health, and you don't happen as a researcher to have any of those things, it involves building relationships across divides in New Haven, which can be really challenging. And then the issue of employing and paying people for their time. It's incredibly important that you do, but I think there are some thorny ethical questions there that I think we need to think about. Planning carefully for time and funding. I mean, I say that, and I've learned that you need to do that, but I think it's pretty difficult to do, because you're asking a funder, in essence, to kind of fund you indefinitely. And obviously no funders do that. So that's a challenge. Being ready with people with the right skills, obvious, but again, not always easy, because we don't necessarily know people with those skills. Taking process notes, we tried to do that, and then we got lazy. But looking back, I think we should have done a better job in one place rather than like 7 different documents as it happened. Just, documenting what you do in kind of ethnography style, right? Today, this happened, and these were the things that went wrong, and this is what we thought about it. And then really thinking about how you disseminate your results. That in some ways, I think it's certainly the most important, but it's also one of the most difficult things to do. So actually have a plan and give yourself time and resources to do it. And then the last thing I say is that, and maybe this is just because, I have imposter syndrome like many of us, but I kind of sometimes assume it's like, oh, it's not really that helpful. People aren't going to really care about this. And no one's emailing me asking me for the results. So therefore, why did I bother doing this? But actually, what we found out is super important, and people can make use of it. So I think, just what I said. Don't assume that if no one asks that it's not worth sharing what you learned. And even if it's only to like 2 people in a webinar, I just feel like it's really worth, or a public meeting in a library that one person shows up to. You have to do that stuff, because if you don't, your research just sinks into academic publications and doesn't go anywhere. I won't go through the results necessarily, but I'll just do this quickly. If you're interested, we can share, the PowerPoints here. This is just some of the findings we had around debt in New Haven, which I think are, I won't go through them in detail, but I think they were fairly depressing. And that's it. So I have some discussion questions, or if you have any questions, please go ahead.
I will give everybody a chance to think about what they want to ask. Thank you, Annie. I think that I have a long list of issues that you have brought up that I'd love to hear more about. I think the first thing I'm going to say in reaction to your very wonderful presentation is I think you sell yourself short. That I think, but it also raises a question of how much are you comfortable doing, as part of your job versus what you think you should be doing. In other words, I think we all have to come to, and that's regardless of whether you're a quant or qual or mixed methods researcher. I think as researchers, we have to be okay and comfortable with what level of involvement, particularly with research topics such as yours, where you want to see, you're hoping for policy changes. You're trying to advocate for a marginalized community or a disadvantaged community. And I think each of us has to be comfortable with how far we're willing to go in that ongoing process. So my feeling, and why I say you sell yourself short, is I think you did an incredible amount of work, and you disseminated it to a lot of different places where they can take the ball and continue. You have given them fodder for their cause. And I think that's an incredible accomplishment in and of itself. There are other researchers who say, no, I want to go the distance, that I want to be not only the researcher, but the advocate and bring this. And you did some advocacy in going to speak at well, I assume at the state level and also at the city level. So at any rate, job well done. Are there other people?
Thank you, I appreciate that.
Yeah, I think you did a fabulous thing. Others want to comment or have questions?
I have a question.
Great, Mai, take it away.
Hi, I'm sorry, I came in a little late, but I really enjoy hearing your talk because it brings up so many interesting issues. I've never done CBPR, but I'd like to in where I work, which is rural Africa. However, so there's a lot of these other questions, but I did want to ask you, have you ever had a chance to talk to the program officer from your funding source about these kinds of problems? And I'm wondering how receptive NIH is. I'm sorry, I didn't know where you're funding. You mentioned Hopkins, but whether a program officer is aware of the challenges of running CBPR and, looking toward changing or including some more flexibility in their constraints for the grant, because I think it's becoming more and more important to them, or, to lots of funders, and how receptive are funders to, changing models of funding to accommodate this more challenging kind of research structure.
Thank you for that question. And I haven't. I mean, I suppose I had a conversation with the program officer prior to a grant I just put in a little bit about this. And actually that in itself is part of the problem, because one of the things I found is that as we're writing grants, especially to the NIH, which I think is the most kind of behemoth and limited and what's the word, restrictive, is that we tend to, and I say we and me and my colleagues, and I'm sure others, we tend to make assumptions about what we are and aren't able to do in our request for funding, because we've heard that you're not allowed to do certain things. And then we're so nervous about not getting funded that we kind of, we play it safe. And in a grant, the grant that we just recently did, I was a bit like, partly because I was maybe being a bit selfish because it doesn't pay, it's not going to pay much of my salary. It's like, let's just go all out and let's say we're going to do this thing, right? We're going to engage community. And one of the things in that particular project is we have committed to be responsive to an local activist group, in that if they approach us anytime during the course of the project and say, look, we're working on this very urgent advocacy issue, and these are people who are unhoused, so sometimes that urgency is like tomorrow, as they say, the emergency is tonight. If they come up to us and say, we have this issue that we're working on, and it would be really helpful for our effort with this particular elected official, whoever it is, to be able to have some data to support our case. Can you give us that data like now, today? And we've committed to do that as far as it's kind of like ethically responsible to do so. And we put that in the grant. And maybe it'll mean we don't get funded, but the program officer that we did have some conversations with around this seemed to imply that that was fine. So yes, I think my answer is we've done some of it, but we need to do more, because I think we might be surprised by that there's more flexibility than we think there is.
I'm going to add on to the question that May has asked and that you've responded to. By first truth, in lending here, I was a program officer at NIH almost 30 years ago. So in ways, my experience and my knowledge are somewhat limited. But there are two issues that go on in applying for an NIH grant. Yes, you can talk to the program officer, but understand, and you should. Don't get me wrong, you should talk to see you've got a certain research question that you feel is relevant to this institute or that institute, talk to the program officers at those various institutes to see if it's within the program's interest. Because it's about, for the program officers, it's about the portfolio and what is the interest of the whatever office you're going to, within whatever institute you're going to, what they feel they need or what they feel they don't need. And you will get, hopefully you would get good information about that. But as far as, and they can give you some information about perhaps about how to, you know, talk about something in the grant application itself. But then please keep in mind, this is external review, so that it is never, it is rarely, I'm not going to say never, I'm going to say rarely. It is rarely the institute itself or the office within the institute that is going to have much power in deciding what gets funded or doesn't, because it goes, as we all know, I'm sure on this meeting, you know, you have first the first review, and you get a score back from that hopefully will be within the funding range of that institute. But then it goes to the council, the next kind of external review, where you have, each institute has their council members who are all not Fed employees. They're all from the outside, who says, yes, we agree that this was a good, so you're reviewed twice. And it's those people who have much more influence on whether a project is going to get funded or not. And I want to come back to something that Annie said earlier. My sense is it has been an uphill battle for particularly for in NIH, where in the biomedical world, I think qualitative research is relatively new. That most of these people were most of your reviewers on the committees, on the review committees, are quant people for the most part. That is changing. I think that they are learning. There are more qualitative researchers out there that they can put those people onto committees, the review committees, and it is improving. So I want to instill a little bit of hope about qual, mixed methods, and other innovative ways of analyzing data that are coming down the pike, that they're always going to be a little bit behind, and you're going to have an uphill battle on something, you know, that's relatively new in the way of methods, but they will find the people eventually. That's all I have to say on that. But other people? Oh, Christine.
Thank you very much for this very interesting talk. And for me, it was very illuminating and also very helpful, because I feel like I'm going to be in the same dilemma in my upcoming project. So thank you very much for sharing this very down-to-earth approach to the ups and downs of research. Because you only addressed the results very shortly, I was wondering if you could go a bit more in depth there. And I was also especially wondering if people were also addressing, for example, their very practical ideas of solutions, or what would help them, you know, not on a structural level, but in their day-to-day struggles. Thank you.
That's such a great question. So I put up the findings, and I can maybe mention a couple things, but I'll just, to get to your second question, that's what I think we wanted to do that we didn't do. So at an individual type level, we did talk to these advocacy groups, etc., that I mentioned in one of the in the presentation. But I think what we wanted to do was to come back and have a community conversation and say, look, we met with you 2 years ago, and this is what we found. What do you think? How can we share this with you? What would be helpful, etc., etc. And so because we did not ask about solutions in the survey, or frankly in the interviews, and maybe we should have, but we didn't. And the main reason is COVID, because we weren't allowed to gather at that time. But it's not really an excuse, because we could have done it once we could have started gathering. But frankly, at that point, we're really busy. We didn't have more funding. We didn't do it. And I was nervous. I find organizing community conversations pretty intimidating. But I will say, to give myself credit, that in a subsequent project that I've done around, specifically around utility bills, actually, so problems that tenants in particular have around living in places that use a lot of energy. We've committed to doing, we did initial community conversations. We had a preliminary findings community conversation meeting, and we're doing another one at the end of this month to actually present the findings and say, and ask those same questions. So yeah, I think I'm hoping that's an effective way to do it, because it's coming up with solutions in a context, in a forum where people can actually go away and do those things together. That's not really my job, right? So we'll see. I'll tell you after June 27th how that worked out. As far as the findings, it was interesting. The number of people who owe money to friends and family, that this was particularly interesting. So only 9% of people owed a library fine, but more than half of them had lost access to essential services as a result. Those are the kind of things that we were really interested in, things that we tend to see as trivial, but actually you have to understand the context, because if a person can only access the internet at the library, then and they can't do that if they owe a fine, for example. What was another particularly interesting one? Oh, that of the people who had ever taken a student loan, more than half had not actually got the qualification that they took the loan to get. Now, some of them were probably, hopefully, still in school, but there was a pretty small number of people who were still in school. So that I found quite shocking. What else was surprising? The number of people who, so I knew about Social Security, SSI and SSDI, those are disability benefits, that a third of the people who were receiving those kind of benefits had to repay an overpayment in the past. And that's when Social Security tells you that you became temporarily ineligible for your benefits because you earned too much or you had savings. Just to know that it was a small number, right? There weren't that many people, but to know that of that small group, a third that had happened to them. And then maybe just the additional one I'll point out that I had no idea was that people who get unemployment benefits, 16%, which I think is a significant number, had also had to repay some of the unemployment benefits they'd received for reasons that I don't know. So that's just some of the findings that I found particularly interesting.
I think that also taking these findings back to the community afterwards, rather than asking them for solutions or recommendations, because oftentimes we all know that, you know, we think we're hearing the truth or that this is fact, when in actuality it may not be quite the way we see reality. It's just the way it's been communicated to us through our various channels. This is a reality check of these are the data that we got from the quant study, and it can help them better prioritize what they feel is most feasible and most important to address, you know, as a community. So, yeah, I think this is incredibly important work that you're doing, Annie. And I hope that you will let us know about further research as time goes on.
Thank you so much. And thank you really for the opportunity and the great questions.
Yeah, no, you brought up a lot of wonderful issues and questions. Is there anybody who has some final comment or questions? We could entertain one more question. Well, with that, I will say thank you again for wonderful, wonderful presentation. Come back and tell us more. And we will meet in July, but not in August. I'm unfortunately away right now, so I can't tell you what is our, perhaps Pete can tell us what is the July meeting?
Let's see, it should be July 21, I would say it would fall.
And do you know who's presenting?
I do not know.
Is it
I know.
Christine?
Yeah, I will present.
Yay!
Oh, great. I'm excited.
Thank you.
Excellent, excellent. Well, Christine, I'm going to be in touch with you when I get back to my office about your presentation. We'll look forward to it. All right. Well, thank you to everybody for attending, and see you next month.
Thank you. Bye-bye.
Bye.